Good evening, everybody. My name is Mercy Idowu, the National Secretary of the Association of Clinical Coding and Documentation Equipment Specialists of Nigeria. So when we talk about coding, this simply means the translation of clinical documentation of that statements into alphanumeric codes that is accepted worldwide. Alright, so it's not just for Nigeria, it's a tool that's being used to classify diseases and injuries by the World Health Organization, used for reporting by the World Health Organization across the globe. Well, clinical coding in Nigeria, I would say, is still in its growing phase. We are still growing, and I believe the future is bright for clinical coding practice in Nigeria. We just need to recognize our strengths, the weaknesses, our opportunities, and the threats, in the threats for the profession or for the discipline as a whole in Nigeria, for us to do it better. Alright, so clinical coding, like I said, is translation of clinical statements into alphanumeric codes. So these codes have specific meanings which are used for policy makers to make decisions, which will affect the patient or client that comes to our facility. It's also being used for medical billing processes, for reimbursement, for revenue cycle as a whole. So this is what codes are being used for. For example, in developed countries like the US, like Australia, and what have you, these codes are used as medical billing parameters by the third-party payers, so who then reimburse the facilities when treatment is done. So, what is the need for the facility? Now, it helps to statistically categorize the diseases and injuries that are being attended or seen in the facility, which will help the facility make better preparation for future preparedness. Let me say that. So in terms of if there's any outbreak of diseases, we are better prepared, and if there's any need for us to make resources available to accommodate the growing number of clients that visit the facility, these classifications, these statistical analysis will help us, help the facility make decisions that will help the facility. So when accurate coding is done, it helps protect the client as well protect the facility, so that the patient or the client is not double charged. And one of the challenges that we have in Nigeria is we don't have enough certified professionals taking up the clinical coding jobs in our facilities in Nigeria. So, and that is why we have data silos in Nigeria. So, we need clinical coders that are certified to be engaged to ensure accurate coding is done. So, which will protect the client and also protect the facility. So, when accurate coding is done, everybody is safe. But when we don't have the certified professionals with the requirements in charge of these positions or handling the coding system as a whole, there will always be problem for the system in our care sector. And we are hoping as an association we will get to the level where we have our own classification. The way forward is the need for collaboration in the healthcare system in Nigeria. There's a need for stakeholders in our healthcare system to come together and harmonize these ideas to make sure that we do it better. We need the doctors, we need the health information managers, or the certified clinical coders, the policy makers, the third-party insurance agencies, and the hospital management of private facilities as well the public facilities as well. Both private and public partnership need to be involved to help grow and develop the clinical coding system in Nigeria. So one of many reasons why hospitals come around and say that they have data laws, they don't have data, and this is because they don't have the right people handling the data. They don't engage the right persons handling the coding system. They don't engage the right persons handling the data protection of the facility. And that's why there's the need for everybody in the care system, everybody in the data system around to come around and harmonize the resources together to help protect the healthcare system in Nigeria. Thank you.